How can you find a hormone doctor who actually knows how to prescribe and monitor hormones for your menopause symptoms? In my last few videos, I've explained that the vast majority of family practice, OBGYN, and primary care providers receive less than about 2 hours of formal education about hormone replacement therapy and menopause. Well, that's not nearly enough for most doctors to feel confident prescribing and managing hormone therapy for you. My last video offered my HRT questions framework. That's a way to have an open, honest conversation about hormones and menopause with your regular doctor. Maybe you've already asked your primary care doctor or your OBGYN about hormones and menopause therapy, hoping for some answers, but they said your hormones are normal for your age. Menopause is natural, you'll just have to deal with it. Or simply, no hormones for you. Well, that's exactly why so many women struggle to get the help they need. Surveys show that only 6.8% of doctors fresh out of residency feel prepared to help women in menopause. That's where a hormone optimization specialist or a hormone doctor who actually understands menopause might come in. These are practitioners with the training, experience, and expertise to know exactly how to optimize your hormones after you've gone into menopause. I've set up a referral system to help connect women like you with qualified hormone doctors near you, somebody who actually understands hormones and menopause. This video is going to walk you through exactly how that process works, but also what to expect when working with both a hormone optimization specialist as opposed to a regular doctor. Well, let me tell you about my own experience visiting with a new primary care provider just yesterday. Nice guy, pretty young, maybe mid-30s. When I told him a little about optimizing my own hormones in cooperation with my hormone doctor, he was, well, let's just say a little skeptical, maybe even a little low-key resistant. He wanted to make sure I knew about a long list of risks and side effects of taking thyroid and testosterone. I know for a fact that the risks that he mentioned aren't really supported in the medical literature. I even looked him up when I got home, and sure enough, he doesn't really know what he's talking about. I mentioned a couple of biomarkers that I've been tested for, and well, he was not familiar with any of those. And I brought up some other biomarkers that he did know about. I consider those to be important, but he said, I don't really think those are necessary to test for. That whole experience got me to thinking about you as a postmenopausal woman. That uncomfortable, awkward feeling when your doctor pushes back against the idea of taking hormones, maybe citing some 20-plus-year-old study or just repeating outdated myths that aren't actually true. Studies show that the average primary care visit lasts 13 to 16 minutes. Barely enough time to even talk about your symptoms, let alone work through some type of comprehensive hormone treatment plan. So here's what to ask yourself about your own doctor, because you're probably not going to have time to ask them. Does your primary care provider actually know how to handle side effects and roadblocks that could inevitably come up with hormones like vaginal bleeding and breast tenderness, drowsiness, nausea, anxiety? Does your doctor even test your hormone levels? Do they understand where those levels should be, or are they maybe just guessing? Or maybe they just don't test at all, sticking to the old lowest effective dose for the shortest time possible philosophy, rather than focusing on what I call optimal hormone levels. If they do test, are they just checking the bare minimum? The estradiol, maybe the progesterone? Or do they take a deep dive into your health and look at all your hormones, including estradiol, progesterone, testosterone, and others? Are they looking at all of your thyroid function, including free T3 and reverse T3 and thyroid antibodies? Are they looking at your lipids beyond just your cholesterol, but maybe even looking at your apolipoprotein B and your Lp(a)? Is your doctor interested in whether you're in insulin resistance? So important. Are they looking at your fasting insulin levels, your fasting blood glucose? What about your metabolic health and C-reactive protein, a marker of inflammation? A hormone doctor doesn't just treat hot flashes. They work hard to help you get and stay healthy for the long haul. Your heart, your brain, your bones, your metabolism, the whole deal. Does your primary care doctor even have the time to look at all those aspects of your long-term health? Instead of the 13 to 16 minutes primary care usually allows, a hormone doctor might spend 30 or 60 minutes with each patient, sometimes more, making sure you fully understand your symptoms, your history, your goals. They're actually going to listen, and that really makes all the difference. Well, I have the advantage of having the confidence to talk knowledgeably with my primary care PA about hormones. If you want to feel completely confident when talking to a hormone doctor or even your regular doctor about menopause treatment, you might want to take a look at my course, The Menopause Solution. Going through all the video lessons takes 2 hours and 11 minutes, more or less. But you'll walk away with more knowledge about hormones than most doctors get in their entire medical school and residency training. Whether you're planning to work with your regular provider or a hormone doctor, this course will help you know what to ask and what to ask for when you meet with your provider. One of my students said this exact thing after taking the course. It gave her the clarity and confidence that she needed to get the right treatment.
What I'm really learning is I have to be much more of a proponent for my own health. I can't just take what they say. I guess I just think everybody knows what they're talking about with the bioidenticals, and they don't necessarily know, and I don't know if I even told this guy that I'm working with that I'm having trouble sleeping. Maybe he would have given me an oral one. I don't know. But as I'm learning more, I know better what to say and what questions to ask and what to ask for.
Well, you deserve to understand your own hormones better, or at least as well as your doctor does. Get started today at simplehormones.com/2hours to enroll in the course. Before you start searching for a hormone optimization specialist, though, let's talk about some realities that you really should know about. Here's something that surprises a lot of women. Most hormone specialists don't accept insurance. Why is that? Because insurance companies prioritize cost-cutting and not personalized care. In a traditional insurance-based practice, doctors are limited to those 15-minute surface-level visits that don't really allow for comprehensive hormone optimization. Most specialists choose to step outside that system so they can actually spend time with you and create a personalized treatment plan, not just check off a bunch of boxes for an insurance company. Since they don't take insurance, many hormone doctors charge a monthly or annual fee for their services. Those fees can vary, but they often cover longer, more in-depth visits, direct access to your provider, often through messaging or telemedicine or sometimes text messaging. They do comprehensive lab testing and evaluation beyond your basic hormone levels. You can think of it as an investment in your long-term health, but it's something you need to be aware of. Another challenge is finding the right hormone doctor takes some effort. Not every doctor who calls themselves a hormone specialist is truly qualified. It's important to do your own research and find a provider who truly understands hormone optimization. Another thing to consider, if your specialist prescribes a compounded hormone like a custom estradiol or progesterone or testosterone formula, that might not be covered by your insurance. It often isn't. There are some FDA-approved bioidentical options like estradiol patches or oral progesterone that might be covered. It just depends. Your hormone doctor can help you figure out what's the best option for you, whether it's a custom compounded formulation or not. And finally, not every area has a hormone specialist. There are hormone doctors across the US, Canada, and beyond, but they're not everywhere. The good news is that telemedicine has made hormone care a lot more accessible than it ever has been. There are a lot of providers who can consult with patients virtually and prescribe treatment remotely. Depends on your state. But even if you live in a rural area, you still might have options. Now that you know the pros and cons of working with a hormone optimization specialist, let's talk about how to find one near you. The best option is to visit my hormone provider database at simplehormones.com/referral. Put in your name and email, and I'll send you a list of hormone specialists that I know, doctors who actually get hormones in menopause. I work with hormone doctors across the US, Canada, the UK, and even some in other countries. I can't guarantee there's one in your town, but I'll do my best to connect you with somebody who truly understands hormone optimization. Here's that link again, simplehormones.com/referral. I can't take referrals on my YouTube comments or on email because my experience is they'll just get lost. They always do. So be sure to go to my website and fill out that referral form in order to request one. I hope to see you there, and thanks so much for watching.